Welcome to your Module 1B of the Introduction to Nursing Research. Previously, you have learned what is the definition of research in nursing, and of course, we were also be able to understand what could be the possible reasons why men are prompted to perform research. In this continuation, we are to further learn what nursing research is and its characteristic, including also the purpose of nursing research. So let us define what is nursing research. According to Boswell and Cannon in 2007, it is a methodic examination that uses regimented techniques to resolve questions or decipher dilemmas. So take note that nursing research is not only used to answer questions but also to identify problems. Schmidt and Brown in 2009 defined nursing research as a systematic approach with a quality of replicability. System and order are the key features associated with nursing research. Research is associated with theory development. So there are some areas they have been pointed as research subjects. For example, in patient's outcome, it could be what are the possible reflection or effects of a certain nursing procedure to patient outcomes, or could there be changes in the patient outcomes due to some nursing intervention. Some subject or is the attitude of nurses towards a certain phenomena or their reaction onto certain uh, procedure or techniques that is being implemented in their institution. Another one is effectiveness of an administrative policies. So, for example, an implementation of an evidence-based practice learned from the result of other researches being implemented to the institution these nurses are working in. Teaching strategies in nursing education, especially to include this time of pandemic where the education system have shifted from face-to-face classes, which means there would be interaction between teachers and student physically in the school, and shifting onto the virtual learning abruptly. Okay, so learning or understanding the changes in this time of shift of education system would be one of the subject in the nursing research. And lastly, contribution to the development or maybe a refinement of theory. For example, you would want to test the theory of Florence Nightingale onto this time of pandemic. So could it be helpful in the implementation or delivery of care or nursing care to patients with COVID-19 or afflicted with other illnesses and diseases? So, what is nursing research according to Pollitt and Beck? They have defined it in 2008 as a systematic inquiry that uses disciplined methods to answer questions or solve problems. For them, the ultimate goal of research is to develop, refine, and expand a body of knowledge. So it is a systematic inquiry designed to develop trustworthy evidence about issues of importance to the nursing profession, including nursing practice, education and administration, and of course, informatics. Take note that Pollitt and Beck have identified nursing research as a systematic inquiry, which means it includes a step-by-step process to be followed, such as, for example, your nursing process. So there are steps to follow for us to successfully conduct nursing research. According to Nis Wiadomi in 2008, it is a systematic, objective process of analyzing phenomena of importance to nursing. So it is leading to the definition or identification of possible problems and solutions to the problems in the nursing profession and practice. All studies concerning nursing practice, education, and nursing administration. According to Waltz and Bosel in 2001, nursing research is a formal, rigorous, and intensive process which is used for solutions to nursing problems or discover and interpret new facts and trends. It could be into the clinical practice again, nursing education, and nursing administration. Nursing research, according to our local organization, Philippine Nurses Association, in 1963, is that research is an honest scientific investigation. Take note that they defined it as honest, meaning there should be no fraudulent data that is coming out of the research results. So it is undertaken for the purpose of discovering new facts, which will contribute to the present body of knowledge and can lead to an effective solution of existing problems. So nursing research for PNA involves careful or critical thinking to revise or even revalidate accepted conclusions or previously held concepts or to establish generalization or principles. Research not only in the education sector is necessary to develop, enhance, and produce more body of knowledge, but more so in the clinical areas of nursing. So, research undertaken to produce knowledge that will affect the conduct of this nursing practice. Clinical nursing research is a research designed to generate knowledge to guide the nursing practice and improve the health and quality of nurses and clients. So there are many reasons for conducting clinical nursing research. So when we say clinical nursing research, these are researches produced by those nurses working in the clinical setting, such as in the hospitals or even in the community. All right? So first, nursing problems and issues which are integral to the work situation. So doing research in the clinical areas may help them identify problems to be resolved later on due to the process of doing research. Personal satisfaction derived from finding better ways of providing nursing care. No one has a greater access to the clients than the nurse. So it is the nurse who is at the bedside 24/7. So they should be the one that is best for the identification of the problems of the patient, not only to be resolved medically, surgically, or through nursing care delivery, but also maybe in nursing research, which may later on could develop another nursing intervention. It could also be therapeutic and enjoyable for the client to participate in clinical research. So we all know that research basically does not have any tangible uh, effect to the client or tangible reward. However, it could be fulfilling for some patients to participate in embodying and, of course, increasing the body of knowledge of a certain illness treatment, for example. Example, this vaccine research. There are some patients that may involve themselves in the creation or formulating of the new vaccine for COVID-19, for example. And it could be reward already for them to aid and help the community in the development of vaccines for this emerging illness. And of course, clinical research is a practical way for a nurse to help improve the health care of the sick and the well individuals. However, even if there are many reasons for us to perform research in the clinical setting, there could be, of course, deterrence on doing research in the clinical areas. We have mentioned in the previous module 1A the possible reasons of why research is not so common to be performed by nurses. However, we have added and listed more below. So first, they are too busy caring for clients. For example, or imagine there could be an 8-hour shift or 12-hour shift in a day, and you'll be doing or rendering this for about 5 to 6 times a week. You'll be having only one rest day per week. So during the 8-hour shift, all of those period are dedicated at the bedside or doing your clinical rounds. So no time really for these nurses to perform research. Another is that unless these nurses has had academic training in theoretical conceptualizations, research may not seem important to them. Okay? We all know that after graduating 4 years of BSN or Bachelor of Science in Nursing, that they have completed uh, or produced a nursing research. However, after graduation, no research at all has been produced by these nurses unless they are enrolled in a graduate school for their master's or doctoral degree. So other than that, they will not perform or do clinical research. So it is important for the hospitals and healthcare facilities to promote nursing research in identification of problems, not only in the unit but also with the patients, and of course to solve problems at their own level of the facility. So nursing research is lacking unless the importance of research is felt and recognized. Nurses may not be able to identify a researchable problem, maybe. That's why they do not perform uh, research. Many nurses do not have the academic training needed to feel confident in doing clinical research because, as I have said, their basic knowledge is coming from their bachelor's degree and no follow up after then. So it is important for health institutions to train their clinical nurses. One of the deterrent is that ethical requirements of research are difficult to comply with and usually tend to score would be or researchers. Okay, there could be certain ethical procedures that we should be abiding with. All right, so before doing research, we all know that there should be ethics clearance, and in the hospitals there are what we call as ERB or Ethics Review Board, or at times it is called as Ethics Review Committee to rigorously um, check the protocol or your manuscript if it is really safe and ethical for the patient's rights as participants of the research. Of course, we have to undergo ethical review since we have human as participants to our nursing research. So lacking nursing research unless administrators, such as the chief nurses, nurse supervisors, medical directors, are research oriented as well. If they are not, come to think of it, how would the chief nurses, medical directors, supervisors would encourage their nurses or low-ranking nurses to perform research if they themselves are not inclined to do it or even not equipped to do it? Or let's say not enthusiastic much that to perform research. The nursing staff will of course feel the futility of support from the nursing or from doing nursing research. And lastly, it takes so much time for the nurses and even cost, especially if the research is not supported by the health facility. It would be an account to the account will all be under the nurse or the staff nurse, which may discourage them to perform the nursing research or to complete it. So would there be difference between nursing research and research in nursing? The nursing research deals with the studies on the process of providing care and concomitant problems therein. Research in nursing, meanwhile, deals with the wider study of the profession in general, such as historical, ethical, and developmental aspects. Examples, how the nurses and their coworkers are educated and trained. Another is information on the clients that they serve and the various settings in which their services are provided. So, nursing research refers to the research done addressing the health concerns of the clients and application of research on their care. However, research in nursing refers to the studies on the particular concerns of nurses themselves. So, what do you think that fuels nurses to accomplish their research? Could it be the money that they will be gaining from it? Could it be the prestige that you have completed and presented your research in local and international arena? So you think of, yes, it could be the interest of the nurse. Of course, even if you will be gaining money uh, upon completing the research, how will you be enthusiastic much to accomplish or do the initial step? Of course, you have to have the interest of doing so. We may consider that the nursing research is an invaluable aid in the promotion and maintenance of health, prevention and cure of illness, and the rehabilitation and habilitation of the disabled and the handicapped whose life depends on others for survival, such as with you, nurses. So the main goal of nursing science is to strengthen the body of knowledge that we have through what? Through continuous scientific researches and logical analysis capable of being translated to the practice that we are doing as nurses. As a basic tool for knowledge acquisition in nursing, research has at least these four specific steps. First is that people or provide efficient and effective nursing care. So the nursing profession exists primarily for service to the society based on accurate knowledge. So how could we solve the problem if we haven't identified it correctly? So data will support us in classifying our interventions and developing further interventions. Secondly, promote the worth and value of the nursing profession to the society. So, to enable the nurses to deliver quality care is to make use of the most recent findings that provide proof of or evidence to validate and justify the appropriateness and advocacy of nursing care. Third, identify, implement, and evaluate effective healthcare modalities, such as nursing research enables nurses to cautiously assess individuals and groups as a basis for planning accurate nursing interventions. For example, you're in the community setting, cases of polio. As an example, you determine how many cases of polio or acute flaccid paralysis or polio risks individuals, especially children, are there or present. So just it could be a basis of the implementation of guidelines and protocols. For example, today with regards to the polio, the whole Philippines is conducting uh, a simultaneous oral polio vaccination because of the number of cases of polio here in Manila and in southern part of the Philippines. And lastly, to utilize clinical nursing research as evidence-based data to provide quality care to clients. So caring of clients who come for illness or for health checks is not only measured through the number of clients attended it or you have attended, but also the quality of care given to them, leading to the outcomes of this patient care. So there could be many reasons for conducting research in nursing. One could it that is that it could gather data or information on nursing situations or conditions about which little knowledge is available. So for example, in terms of the COVID-19 cases, we don't know yet the real numbers of COVID-19 cases until the government performed mass testing or identified mass testing. So, secondly, it provides scientific knowledge based from which nursing theories emerge and develop. So, for example, uh, we could use Florence Nightingale theory, Lydia Hall's theory, Madeline Leininger's theory, and all the other nursing and non-nursing theorists. Okay, remember that these theorists are, or the theories of these theorists are utilized as backbone in the process of performing research. We use specifically nursing theories to enhance the science of nursing itself. Third is that it helps correct, clarify, validate, and expand perceptions and provides theoretical and scientific basis for nursing practice, define parameters of nursing, identifies its boundaries, of course, and documents the social relevance and efficacy of nursing practice to patients and the healthcare providers. Research in nursing is generally vital to well-being of the mankind due to its valued tasks, which are the following. So in addition, this describes the characteristic of the nursing situation about which is little known in the current practice of nursing. It predicts probable outcomes of nursing decision relating to the client care, provides knowledge for purpose or of problem solving and decision making. It may also develop and evaluate nursing theories and concepts and practices, which this for clarity and validity of nursing actions. Could it be really related to the theory of a certain theorist? Prevent undesirable client reaction, and of course develops considerable degree of confidence. So now let's go to the purposes of nursing research. There are many purposes of nursing research, and first one is to describe. So research aims at describing a specific phenomenon that relates to the nursing profession. It may involve understanding the nature of the phenomena and sometimes the relationship among them. So basically just to describe for you to be able to increase your knowledge about a specific or certain phenomenon. Secondly, the purpose is to explain. So research seeks clarification of prevailing situation to answer question that asks why a phenomenon has occurred. It may help us clarify the relationship among phenomena and identifies the reason why certain events occur. And it could be the basis for conducting research for prediction and control. Third purpose is to identify. Nursing research assesses the situation that needs clarification and solution. Another purpose is for us to explore certain happening in the area or in the surrounding as nurses. It answers what questions on the phenomenon, searching for illustrative examples in order to become familiar with the specific phenomenon and of course to understand it more precisely and accurately. Prediction is when research projects, situations, or events that could arise from research investigations. So through prediction, one can estimate the probability of a specific outcome in a given situation. However, predicting an outcome does not necessarily enable one to modify or control the outcome. And lastly, is to control. Research puts up a barrier to hinder or minimize the effects of anticipated outcomes or reactions. If one can predict the outcome of a situation, the next step is, of course, to control or what we call as to manipulate the situation to produce the desired outcome. There are five characteristics of research: orderly and systematic, control, empirical, generalization, and intensive. When we say orderly and systematic, is that the researcher undertakes the investigation systematically in an ordered sequence of steps. So control is when the researcher identifies and eliminates specific constraints to limitations to ensure precise and valid results. Usually it is performed during experimental studies, okay, where there are two groups of participants or respondents of the research. So every step of the investigation in a controlled research environment is planned. Empirical is when the researcher uses results of experiences and observation rooted in objective reality as sources of knowledge. So empirical is when the evidence is already at hand and there is a confidence in the coming results of the research. Generalization is when the stage where the findings of the study are deemed to have applicability to the entire population. So, for example, it could generalize to all patients having diabetes mellitus or all nurses who are working or placed in the emergency room. However, generalization is not usually seen in all types or all kinds of research. For example, in qualitative nursing research, it is not or it does not uh, generalize the phenomenon or experience to all kinds of patients, to all kinds of nurses and the like. And lastly is intensive. It is an in-depth use to ensure that all the possible loopholes in the study are, of course, covered.